Welcome to the Stories Behind the Science, an intimate conversation series with the authors of the Academic Medicine Supplement on Disability Inclusion in Undergraduate Medical Education. In each episode, we step beyond the printed page. You'll hear directly from the authors, their motivations, the lived experiences, and data that shaped their scholarship, and the futures they imagine for a more inclusive profession. These aren't just studies or commentaries. They are stories of systemic change and of a deeper commitment to justice in medicine. Together, we'll explore the supplement's 6 themes: the evolving landscape of disability inclusion, the learning environment, disability at the intersections, barriers to entry and transition, new frontiers in disability research, and real-world case studies of inclusion in action. Through these conversations, you'll meet the people behind the work, their stories, their visions, and the communities that drive their scholarship. So join us as we uncover the stories behind the science, stories that are reshaping medical education and ultimately the future of healthcare. I'm your host, Lisa Meeks, and I'm so happy to welcome today's guests, Doctors Carol Haywood and Chris Moreland, 2 brilliant researchers and advocates. Their study, part of the Academic Medicine Supplement on Disability Inclusion, takes a hard look at technical standards, the document that quietly shapes who enters medical school. In this episode, we talk about what technical standards represent, why words matter from day one, how they shape belonging and opportunity, and what schools can do right now to make their technical standards accurately reflect their values.
I'm Carol Haywood. I'm an assistant professor in the Department of Medical Social Sciences at Northwestern University's Feinberg School of Medicine in Chicago. I have a clinical background in occupational therapy, but as a researcher, I focus on disability and health services, including how people access and experience healthcare, and I evaluate ways to advance safety and quality of care that ultimately advances health equity.
Hello, I'm Chris Moreland. I'm a professor of internal medicine and division chief for hospital medicine and interim associate chair for faculty affairs and faculty development here at Dell Medical School in Austin, Texas. I am practicing as a hospitalist and have been deaf since birth and working with interpreters for most of that time. I've had a long-standing interest in the experiences of people with disabilities, both as community members and patients, and also as part of our healthcare workforce. During this podcast, I'm going to be making my comments using American Sign Language. My comments will be voiced into spoken English through an interpreter.
I'm so excited to get your perspectives on this project and the paper. So I'm going to start with the question we're asking everyone. What inspired you to pursue this line of inquiry? Was there a personal or professional story that motivated the work?
My honest truth is that I kind of stumbled into this work, and I'm really honored to be part of it. As a researcher, I center voices of people with lived experience of disability to really understand their healthcare access and coordination of care and overall quality of care. And just prior to starting this work on technical standards, I had been involved in some research with Drs. Lisa Iazzoni and Tara Legoo that explored some physicians' perspectives on caring for people with disabilities. And of course, it won't really surprise anyone in this audience to hear that key findings of this work were that doctors are commonly unprepared to care for people with disabilities, and they often see people with disabilities as different and sometimes even undesirable, and that these negative attitudes about disability sometimes lead to discriminatory care. So for many reasons, I believe that doctors with disabilities have an essential role in healthcare, and that they may be part of the solution to mitigate some longstanding disparities in care that we see for people with disabilities. And so that's really how I had started thinking about the space of medical education and diversifying the workforce within the medical profession. But in the spring of 2023, I met our lead author, Tracy Singer, who at the time was just finishing her first year of medical school at Northwestern. And she was interested in a summer research practicum with myself and Dr. Tara Legoo. And so on the heels of this work with Dr. Iazzoni and Tara Legoo, I had been thinking about a lot about underrepresentation of people with disabilities in medicine. And we had read a lot of your work, Lisa, and we were really interested in building on what you and others had done to examine technical standards as a barrier to entry for disabled learners. So we reached out to you, and you were so generous in taking our call. And we were interested in collaborating and thinking more about how to better understand and benchmark technical standards. So in this work, we kind of built the project from there. It was a passion project that included learners at various stages of their training, as well as individuals who have experience and prior technical standards reviews, and other experts in the field of medical education. So it's really been a thrill to do this work, and especially an honor when Chris and you, Lisa, agreed to be part of the collaboration.
Well, thank you so much. I have to thank you back because this supplement, I feel like, wouldn't even exist had it not been for you and Tara. Just really encouraging and looking at early drafts of what this might look like and just being cheerleaders, really, for pulling us all together in this space.
I will absolutely give that credit to Tara. She's a visionary and kind of thinking about how to push impact. So it's really been a great learning experience for me as well.
Great. And Chris?
Thank you. I was likewise thrilled to be invited to join the team and participate in this work. As I think about what inspires me or motivates me to do this kind of work, it's really personal for me. When I think about technical standards, I think back to when I was applying to medical school, and I was asked if I thought I could meet the technical standards document and the language that was outlined there. I was even called after an interview to have a heightened conversation about that. It was both uncomfortable and made me very uncertain about the whole legal nature of that conversation and if that would impact my chances of getting accepted to that medical school. Since then, I cannot count how many conversations that I've had with colleagues with disabilities who have shared their feelings of uncertainty or anxiety about the impact of technical standards on their chances of getting into medical school and their careers as a whole. Around 2015, Phil Zazov and I had a great opportunity to look at technical standards and get a sense of the landscape at that time and see how it's evolved. So I was really thrilled to be able to support this team in taking a more nuanced look and really a more detailed analysis of that work.
So, behind every research study or research journey are challenges and surprises that are unique to the project. I'm wondering what challenges or surprises you encountered while doing this paper.
I think the first challenge I want to share is one that's not unique to this project, but because we had such a multidisciplinary team with learners at every stage and individuals in different work settings and with different priorities, we really had to be very intentional and flexible in managing competing priorities and schedules and aligning availability to really collaborate in the work. We did the coding together as a team. We met regularly to discuss the coding and to really think through analysis. And that took time and intention as we were all pulled in different directions. And so I think that was one of the big challenges and extended the timeline of the work, I think, longer than we initially anticipated. But really, overall, I think made it richer, better work. I think another challenge, maybe more specific to this research, is that we commonly found technical standards that were difficult to interpret. Our original intent was to code all domains of technical standards. Technical standards are typically organized into 6 domains. Those are observation perception, communication, motor, intellectual and conceptual abilities, behavioral and social attributes, and professionalism and ethics. So we started developing this coding scheme or coding taxonomy that would allow us to evaluate all of these different domains of technical standards. And as we dug into that, it became very difficult to objectively categorize some of these technical standards. And we saw patterns of certain domains that were difficult to interpret. So we found specifically that it was hard to systematically and reliably interpret the domains for intellectual conceptual abilities, behavioral and social attributes, and professionalism and ethics. The language there was just really ambiguous. As an example, one of the technical standards read that applicants must, quote, be able to accurately write prescriptions, accurately perform basic mathematical functions, and accurately and quickly read charts with minimal error in areas where there may be distraction, end quote. While we know that there are accommodations and innovative technologies that are available to support all of these competencies, the technical standard itself is written with these vague qualifiers such as accurately, quickly, minimal error. And so we couldn't actually determine how the standard would be evaluated in this case. And when our team met, we realized that if we couldn't determine how to evaluate these standards, how could we expect applicants to be able to evaluate them? And how could we do this in a way that could be reliably repeated over time?
I was actually thinking about the exact same thing that you brought up, and I'd like to build on that a little. I agree that one of the things that struck me the most about the results of our findings was how all of the technical standards language appear to be detailing what's most important for applicants. And these are people who have not yet been in the medical education environment. They don't have the scaffolding to be aware of what it truly means to have a diagnostic conversation or write a prescription or all of these sorts of things. So it's pretty ironic that in our field in healthcare, we work very hard to make it as explicit as possible to our most important stakeholders, our patients, make sure that they're understanding their healthcare and have health literacy as well as literacy in other forms, but our technical standards are not written with applicants in mind. So that continues to be one of the takeaways for me with this. That is one of the biggest surprises for me. I was also pleasantly surprised to see that almost all, and I believe more than 90% of the technical standards were publicly accessible through the school's websites. That has not always been the case. This is an improvement, but then we're looking at the language itself not being so accessible.
Yeah, that's a good point. In a lot of our studies lately, we're finding that more people are actually discussing disability or having a policy or getting accommodation approval, but we don't know about the quality of those accommodations. And here, obviously, the quality of the technical standards. I think you make a really good point, Chris, about the kind of nascent understanding of what these would even mean. So not only, Carol, to your point, are they not operationally sound? Because if you put 10 people in a room, no one's going to be able to, describe how this is going to be measured or what it actually means. But then, Chris, to your point, if all of these experts that have been through medical school are teaching in medicine can't decipher these, how is someone who's never been in a clinical setting outside of volunteer work supposed to understand what this means? This is information that is really lending itself to a fairly large decision about whether to apply. And we know that students with disabilities tend to be marginalized just because of their status as a person with a disability, but many are coming from other marginalized groups where they may not have the resources to apply to all 155 medical schools. So this is really important information that's helping them discern whether they feel safe and whether they feel like they would be a good match for that environment. Yeah.
And I'll add a comment here. If we take a step back and think about the larger picture of applying to medical school, I think that this is not something that we assessed in our data, but I think in general, med school admissions offices and websites tend to be very clear for those who haven't been to medical school. So that's an interesting contrast with the technical standards language, which really should align with the accessibility of the admissions office's communication strategies in general.
Absolutely. To plug another paper in the supplement, there's a paper on websites and how disability inclusion is communicated through the website. One of the things that I love about the supplement was that I was on that project as well. And then this project was developing. And I knew that you were looking at different but really complementary areas. And so I love the whole picture that is developed within these two papers. Okay. Well, one of the reasons we wanted to do this podcast series was because there's a lot of research in this supplement, but it's really important to understand why the research exists and what the stories behind the science are. And so to that end, if you think about the human story underneath your findings, what stands out most to you?
I think our research is interesting because it's not actually collecting data or information from individual people. We were reviewing documents, right? And so in many ways, it can feel very separate from human experience. But we know the reason we're doing this work and what we kept coming back to is the way that this document actually drives human experience. And there's unfortunately been many trainees who have shared their own stories of fighting against technical standards or having their offer to medical school rescinded. And there's case law around this. And so we were really grounded in these stories as we came to this work, and we were motivated to think about the implications of technical standards relative to these individual learners' experiences. I'm glad you brought up that other paper about the websites, Lisa, because one of the things that we've thought about too is just how much technical standards can be a reflection of a school's position on diverse learners. And similar to websites, this is something that's public facing. It's one of the first things that applicants interact with as they're exploring different medical schools. And technical standards are a very prominent signal of whether medical schools have focused on competency in their standards, whether or not they're really focused on the results of learning, or if they're stuck in these more antiquated ideas about how individual bodies should look and how they should function within the field of medicine.
I think looking back to one particular experience that I had with the impact of technical standards at an institute where I previously worked, I approached our dean for admissions, who was just fantastic, about our institute's technical standards document and how it was not aligned with what we've been learning. That dean and the admissions committee and I sat down and brainstormed about how to revise the language to make it aligned with the institution's philosophies and needs, while also being more welcoming and inclusive of people with disabilities as applicants. The very next year, after we revised that language, we got what I think would be the best kind of feedback to receive. There was an applicant who had an interview and after approached the dean of admissions and mentioned that they applied because of the language in the technical standards. They thought that it would be a fit for their lived experience. And that is just a fantastic piece of feedback. Based on that experience and looking at our findings and the types of striking variation that still exist among schools, whether regional or by MD versus DO granting organization, the way that we dig into this, we still have a lot of work to do to get to a place where med schools can really embody and communicate that type of inclusive approach. And we want to see them do this without strict technical standard language, as we see in many of the schools that we analyzed.
I really love this story, Chris, and thanks for sharing that. What a great example of real world impact. I hope that medical schools will look carefully at the taxonomy that we use to code these technical standards, and they can embrace it as a guide to revise their own technical standards to comply with recommendations for competency-based learning, we've really carefully analyzed how individual words can entirely shift the meaning and expectations for learners. I can offer a couple of examples of this if that's useful. When we talk about things in the motor domain, for example, a functional standard might be something like provide or direct general and emergency care. Very easily, that can be an organic standard if you put in something about an expectation for motor skills or motor capacity. So a real example of this that we saw in the data is a standard that says an individual must have sufficient motor capacity to perform physical exams. What strikes me there is just this real failure of imagination and innovation to be stuck on focusing the standard on motor capacity rather than the performance of physical exams. And so I hope that the intentionality that we brought to analyzing technical standards is something that can help medical schools actually revise their own standards and think differently about what the end goal is for medical training and be able to bring in more learners into their space.
Carol, I love your comments about med schools being able to use the structure represented in this paper, the coding and analytical approach, and apply that internally to their own internal assessments. I think that's a wonderful idea. There are a number of ongoing conversations in medical education where I believe our results tie to and inform those conversations. One is the concept of totipotency among med students. And this is the concept that any med student needs to be prepared to go into any field. And that's been discussed for quite some time, and it becomes even more important in the disability context. We've also had ongoing discussions in general med ed about connections to different stakeholders beyond the usual core of the administrative and faculty teams who are making decisions about curriculum or policy and the structures of those. We do have an additional opportunity for institutions to engage their faculty, their communities, and their learners with disabilities to really inform all of these different elements, including their technical standards, and make them much more robust and meaningful. That's part of what I really hope will be an outcome of this work.
I really hope people read it, and there's such a clear guide for this in Mike McKee's chapter on technical standards and outline of what to do. And there's so many examples in the literature and obviously with this paper. I just really hope that people use this as an opportunity to reflect and to pause, and then hopefully to create committees that are charged with reviewing and revising technical standards. And I think both of you would really agree. They need to include learners with disabilities. I think that's a missing piece on so many of the revisions on disability policy, is just not having learners at the table, which is a huge mistake.
I couldn't agree more on that. I also want to underline one of the findings. We looked at technical standards and also examined some patterns in terms of characteristics of medical schools. And similar to prior work in this area, we were disappointed to find that medical schools that have been more newly established have actually not shown to have more functional standards. We would hope that these continued conversations and advocacy would be pushing new medical schools to really think differently about the way that they're organizing learning and competencies, but that doesn't seem to be the case in what we found. Something more hopeful that we did find, though, is that schools who reported revising their technical standards in 2022 or later have shown that they're leaning towards more competency-based or functional-based standards. And so there's something emerging there that I think we can continue to push, and a model for schools to really say, despite how they've been doing it for a long time, we can do this differently and still maintain a lot of excellence in the field.
I'd like to add to that. I totally agree. It seems there's something about the intentionality of the work here. Having a specific strategy for updating and reassessing technical standards is important rather than being part of creating them. I think there's a really interesting nuance there that you're pointing out, Carol. And I think that's what we found is the team assessing them in this paper.
The question that the listener will have, that's the question I get all the time, is there a school that you would hold up as the model for technical standards? And I know I have my answer that I give back, but I'm curious for both of you, having gone through, looked at the coding for all of the schools, if there is a school, and if not, why not?
I think that it's risky to say that any school is doing it perfectly right now, and there's room for improvement across all medical schools. I was really thrilled to see the work come from Cheryl Holmes's team in Canada to develop the core competencies for students entering medical school, which very much aligns with the spirit of our work. They provide really clear recommendations for centering functional abilities in technical standards or in competency evaluation. And I'm excited and, dare I say, a little hopeful about ways that this might push efforts across the United States and continued partnerships to really build on these consensus standards that can make medical school more accessible and inclusive for all students.
I think technical standards can be written really well and the culture can be terrible. I think technical standards can be written really poorly and the culture can be amazing. So much of the disability inclusive approach is dependent on specific actors in the environment being there. And so with changeover, it's also really important to consider who are the people behind the policies, because those are the people that are going to drive really how this is not only operationalized, but if it needs to be adjudicated, how that's going to occur as well. So really getting that whole picture is important. Your paper contributes to a larger supplement, which is exciting. How do you see your work fitting in? You had a chance to see the supplement. Where your work is situated is actually very close to where some of these other articles that we've been talking about lie in this landscape approach. How do you see your work fitting into the bigger picture that the supplement provides?
The supplement really brilliantly spans every stage of medical training, and our work to examine technical standards is directly relevant to the very beginning of one's journey. And I think there's ways to really think about the inconsistencies of experience over people's time, and the research in the supplement shows that even if there are signals of inclusivity at the beginning of one's medical training, it might not be ultimately their experience as they move through their medical training and into residency.
So trainees looking at your paper, looking at technical standards, thinking about going to medical school, what would be your take-home message for them?
Looking back to the many conversations that I've had with my colleagues as mentees with disabilities who are trying to interpret the technical standards and other signals from different medical schools and other professional schools, I hope that our paper and its results validate their experiences as they look at the technical standards. Sometimes they have a hard time understanding the point because the language is not clear. Other times they read a document and think that that's really sounds like a fantastic fit for who they are as individuals. It varies across institutions, and it really is something that's present and needs to be addressed. So that's my first thought, and I hope that pre-professional students will find the results validating of their experience. Secondly, as we've discussed earlier in the podcast, I agree with Carol that I hope that administrators and educators will look at this paper and really take to heart and assess the impact and interpretability of their own technical standards.
Thank you so much. I agree. I hope the learner feels validated, the applicant feels validated I see that throughout all of the articles. I think that the findings are awful in some of the papers, but you have to define and show this finding in order to address it, right? So I hope the learner understands that publishing it is the first step. And then we start to work to correct the drivers, the barriers that are causing these poor outcomes or poorly defined technical standards. Being a researcher is fun. At times it's frustrating though, because you get done and you're in the middle of one project and you're already thinking of 6 other projects that need to be done, right? You've just scratched the surface. And I know a lot of work has been done around technical standards, but what is the next step for you? What are the questions that you have related to research?
So I'm a researcher, but at my core, I'm also an occupational therapist. And in this way, I am oriented to and really kind of think with a lens of celebrating creativity in form and function and really pushing the boundaries of how people engage with the world. And so in this way, I loved examining technical standards because it was that. It was really thinking about what are the requirements for how people perform medicine and how can we think about the end result of care. And so I've been thinking a lot about bedside medicine from the perspective of how physicians are trained to examine people with disabilities. But I also have been thinking about it a lot about how people with disabilities can be exceptional in performing exams. In a lot of my other research, I hear again and again that people with disabilities go years without having their physician lay hands on them. They really miss getting thorough examinations. And at the same time, physicians commonly report feeling underprepared to actually work with bodies that don't look exactly like the bodies that they interacted with during their training. And so if they're not engaging with disability during their training, they don't feel comfortable engaging with people with disabilities in their practice. And this is a huge problem. So I'm excited to think more about the ways in which people with disabilities who are experts in their own bodies, but who also have this essential understanding for the ways that bodies adapt and function, I think that they approach patient care in this more intentional and thorough way that I want to better capture through the research. I want to actually substantiate that and really explore that through research. And so I'm eager to pay more attention to that and continue learning from both patients and physicians in that space.
I love your answer. Chris and I have been trying to figure out the methodology, and I had a moment where I was like, that's it. That's how we measure it. But with each new methodological approach, within hours, the conflating variables start almost like a rainstorm start coming down. But I think this is critically important.
What an amazing answer, Carol. I have to agree with you as well, Lisa. Yes, we have so many avenues of potential research, and some of those I captured in my thinking earlier. Exploring accommodation quality, not just the receipt or presence of accommodations, but how effective those accommodations are and how they empower disabled people and institutions, how we empower them both to assess quality. I'm excited looking at the experiences of healthcare faculty with disabilities, which is still a largely unexplored area, and their relationships with patients and their impact on patient healthcare and outcomes and experiences.
So what I'm hearing is that we have some more collaboration to do.
So in the last few minutes, one of the questions I love, because, well, you both know, I love to cheerlead people, is thinking about all the things that prompt other work and all the people that may not be authors or that are authors and that you don't get to thank, but that contribute to this work in some way, shape, or form, right? So for me, Lisa Iazzone's work and Christy Kirshner's work were what even sparked the fire for me, right? And I've had reviewers where I was like, I wish I knew who a reviewer two was, because they gave me an idea for another study or gave me a different lens to look at my findings. And so there are all these unsung heroes in the contribution to the final product. And I just want to say first, the biggest unsung heroes are the learners, right? That give us data or that are out there living this every day. And so I always like to thank them. But who do you want to thank? Everybody has these people. And I wanted to give people an opportunity to celebrate. Like, who is your cheerleader? Who gets you through the work? And who sparked and contributed to this paper in particular?
Thanks, Lisa. What a great question. Tara Legoo has been a really formative mentor for me and really pulled me into this space. And I'll be forever grateful for that. And she sparks passion for many groups and many teams. And I've just been grateful to learn from her and work with her. I also have to say, at the risk of this sounding like I'm saying it just because we're in this conversation together, but I have to thank you both, Chris and Lisa. I'm not a physician and I'm new to this world of medical education. And I learned a lot through this process and learned a lot about the history of challenges related to technical standards, the advocacy that's happened, that continues to happen, and the ways that you're both pushing the field forward. And so I'm just really grateful and have so much respect for your expertise and legacies of work. And I'd be remiss to not mention that we had 5 medical students and graduate medical students within our author team who jumped into this work and really trusted us and trusted the process and gave so much of themselves to think through coding and to dedicate themselves to coding and analysis. This work would not have happened without them, and we're really grateful for the ways that they came to the work and helped move it forward.
Absolutely. I wish I could name all of the learners that we've worked with over the years, but at the moment, I think recognizing them as a whole is key. I do want to really look back and name 2 people who were key to my stepping into this work and encouraging me to do it when others told me that looking at physicians and students who were deaf or hard of hearing or who had other disabilities was not big enough work to do. One is Phil Zazov, and the other is Darren Lattimore. They both were remarkably encouraging and got the impact right away. They were remarkably enthusiastic. And when I proposed the idea of my first project to Phil Zazov, he was at an international conference and responded immediately, then sent me several emails over the next 24 hours with even more ideas. That kind of enthusiasm felt untapped at that time. And I've just been watching it grow ever since. So having those kind of mentors to support and pave the way was just invaluable. I also want to name the awesome interpreters that have worked with me over the years, 2 who are in the room with me right now, Todd Agan and Amanda David, who are both part of the access work that happens with these projects.
That's amazing. I'll second that, Phil Zazov. And I wouldn't have the career I have without Chris Moreland, because he invited me to my first research study when I went to Michigan, which he probably now regrets. He's like, what did I do?
No, Lisa. No regrets. Our partnership has truly been, well, I don't know how to describe how precious the partnership has been, both personally and professionally. And then working with you, Carol, as well, has just been fantastic.
Wonderful. Well, I appreciate you both so much. Thank you for doing this. Carol, OTs are my favorite people in the world. So anytime you want to do work, let me know. But I appreciate you both. I love this paper. I'm proud of this paper. And I think it fills an important gap. And so I appreciate you, and I appreciate you doing this podcast.
Thanks for your leadership, Lisa, and for this opportunity.
Thank you for making the space, Lisa.
Thank you, Carol and Chris, for such a thoughtful conversation. Today's episode reminds us that technical standards are more than policy. They're a reflection of our values. So here's your call to action this week. If you're a leader or faculty member, read your institution's technical standards and ask yourself, would an applicant with a disability feel welcome here? And do I fully understand what my technical standards mean and how we would measure this? If you're in admissions, pull together a committee to review your language for clarity, flexibility, and alignment with best practices. We've put some resources in the show notes to help you do this. Finally, share this episode with a colleague. Start a conversation in your school or amongst your region. It's been my pleasure to bring you the stories behind the science. We hope you've enjoyed this peek behind the curtain from the Academic Medicine Supplement on disability inclusion in undergraduate medical education. We hope you'll stay with the Docs with Disabilities podcast and subscribe. Until next time, I'm Lisa Meeks. Thank you for listening.